Hello souls, how are you all? It's really exciting to be here with you all today for episode number 40 of the Skin Education series. So tonight I'll be talking all about skin conditions related to texture. So this is a follow-on educational chat from last week. So last week we spoke about skin conditions relating to secretions, and then next week we'll talk about skin conditions relating to color. And just to give you a little bit of background, there are 3 types of skin diagnostics, you could say. That's what skin therapists will do anyhow. So we put them into different categories, and within those categories of skin diagnostics or conditions, we have other little conditions underneath. So we have, again, the texture, which I'll be covering today, and within texture we have excess keratinization, incomplete corneocyte compaction, open and closed comedones, keratosis pilaris, and a loss of collagen and elastin. What the heck are they? Well, I'm here to talk to you all about it today. Last week we spoke about those skin conditions related to secretions, which is a really interesting one, and acne, yes, it does fall into that category. However, acne definitely falls into texture and color as well. So next week we'll cover color. And essentially, it's really important to understand what these conditions are, because if you are coming to see me as a client, I will actually send you a skin report after your initial consultation that basically outlines exactly what I have found on the skin. What the heck are these conditions? And so we can actually start to work on it and get your skin back to health. I know it might sound like all these weird jargon words, like what the heck is that? I'm here to break it all down. And I do think it is really important to actually share a little bit of extra information with my clients. I do know that not all skin therapists will talk in this way, and they won't give you so much detail, and that is totally okay. But the way that I like to perform my treatments and I like to provide the services that I do, I like to educate you so you know exactly what is going on with your skin, so you can figure out, why is it like this right now? This is actually what's happening in the skin cell, and this is how we're going to treat it. I definitely know that from when I treated in a different way prior to owning my business to now, I'm getting better results, better retention, and everybody is just really enjoying it. So I'm excited. I hope you're excited. Hello to everyone who is watching. The only person that I can see who is watching right now is the lovely Gracie Briffa. That is my gorgeous mum, my #1 fan. Hello. So happy you're here. So let's just get into it. I'm going to go through every single condition that I just mentioned and talk to you about what they are. I do have my skin diagram with me today, and the skin diagram up here, so let's get into it. But you would probably know what these conditions are, and hopefully maybe this will help for you to understand what's actually going on in your skin. I'm not asking you as the client or the consumer, whatever you want to call yourself, the lovely human being living in this world. You don't need to diagnose these for yourself, and I don't expect you to take this knowledge into your life and apply it and fix your skin. That's not really what this is about. This is more about just understanding what is going on with your skin. So from the top, let's start with excess keratinization. So what is that? Well, your skin is mainly made up of keratin, hence excess keratinization. So basically, keratin is a protein, right? We're basically just protein. Just remember that. We're basically just cells full of protein. But anyhow, basically a keratinocyte is made up of keratin, and it actually goes up through our skin. It actually transforms into what we call a corneocyte when it gets to the top, but that doesn't really matter right now. What I want to say to you, excess keratinization is essentially an excess of keratin in the skin. It is kind of a skin that is a bit clogged up. Now, it's not clogged up from within, it's kind of like a little sheen on the top. So it's really common, and it's one of the main conditions that I see with most skin conditions. So things like acne and Oh, sometimes rosacea has a little bit, most conditions do, let's be honest. And the way that excess keratinization presents on the skin, have you ever accidentally sprayed hairspray on your hair and then it's landed on your face and you've got this shiny sheen on the skin? It's a really bizarre thing, but I'm sure you've seen it before, and it kind of looks like it reflects light and it kind of looks like it could be moved almost. Well, that's what excess keratinization looks like on a smaller scale. It's when we're really looking at the skin cells. They look a little bit shiny, they look a little bit kind of jagged, and basically if you kind of press the skin together, it'll kind of, oh goodness, it'll kind of look like little crepiness in the skin. It's usually a little bit of a rougher skin, but not always. And essentially, you know, exfoliation might seem like to you that that is the answer to treat this. I guess, yes, exfoliation does play a role, but it's not the answer to this condition. It's more about treating the skin from the inside out. Why is the skin presenting like this in the first place? Let's treat the root cause. And that's how I do everything here. It's inside out therapy. So what is this excess keratinization? That's basically what it looks like on the cells, but it just on your skin, but essentially it's just cells that are kind of clumped up on your skin in a really, really simple way. And I will treat this in clinic. Well, first of all, if the skin is healthy and it is strong enough, I will perform an enzyme peeling mask on the skin. Now, it's not peeling or going to do anything bad. I think the name doesn't do the product justice. It's actually a fantastic anti-inflammatory enzyme mask that I pop onto the skin, and it just kind of helps the cells to essentially smooth out. So these cells that are kind of clogged up on the skin, it's because either the corneodesmosomes, so joining the cells together, are kind of still attaching onto cells that are ready to be flaked off, or a multitude of reasons. Things have just gotten sticky, right? So we do want to remove them very, very gently without impairing the skin barrier and without impairing the skin or causing excess inflammation. So it's about really understanding, is the skin ready for this treatment? And if it is, that's my first protocol. But that is not the solution. We need to, again, treat from the inside out. So we've got to think about, why is the skin like this? Perhaps it's an essential fatty acid deficiency. That is so common. People not eating and consuming enough essential fatty acids, so your omegas. I think I want to do a whole broadcast on that. Let me know if you'd like to see that and learn about your omegas and why it's important. I'd be very happy to do that on another day. It could be because there's other skin conditions going on. I find excess keratinization is just kind of like an aftermath of what's already happening. So we've got to make sure the skin is retaining the water so the cells don't kind of clump up in this way and kind of stick on. So that's essentially what that is. It's just excess cells. And oh, it could also be hormones as well. Of course, I can't believe I almost forgot that. So yeah, hormones will play a huge role. And the next one is, it might seem a little bit similar, but it's kind of from inside up. And it's called incomplete corneocyte compaction. My goodness, what a weird one. But essentially, in a really simple way, your skin is basically made up of bricks and mortar. And I'm going to talk to you, kind of show you here. They kind of look like bricks, right? And then around the bricks, we have the mortar. It's essentially, well, it depends where in the skin layers, but essentially it's like a liquid, you could say. Gosh, it's so much more to it, but let's just think about bricks and mortar. And essentially you want nice, strong bricks, you know, that it's going to keep a wall up and sturdy. But when we lose water out of our skin, there's things going wrong, right? So the skin is impaired and unhealthy. The barrier is impaired. We're losing water. There's not enough nutrients in the skin. There's inflammation. There's a skin condition, right? What happens is these bricks, they're broken bricks now. There's mortar that's an excess over here, but there's a little hole over here, and it's just this, essentially a brick and mortar wall that's, oh, it's just a bit bumpy and it's not right. So basically that's a really simple way of putting it. And incomplete corneocyte compaction will generally, I usually see it with excess keratinization, and it's just a bumpy skin from underneath. So again, we can treat that with making sure to retain water in the skin, repairing the barrier. It's so many little things we've got to do. Oh, it's also to do with the enzyme function. So don't want to go too much into this, but essentially we have these things called trimethoprim enzymes, and they basically help the skin to be smooth. And if there's no water in the skin, these enzymes can't function. So again, hence why we need the water in the skin. So that is a condition, again, I see with acne. I see it a lot, and we can fix it, right? So that's one of the ones. And if you do come in for a skin consult with me, I actually do break it down a little bit more in the skin report I send you. And it does go into a little bit of the science, but I just wanted to make it relatable for today. So the next one on the list, I think you'll enjoy learning about this one because you all have experienced it. I know you know what they are. Open and closed comedones. Basically, blackheads and whiteheads. Not the whiteheads with the pus. I feel like some people interchange the names. It doesn't really matter at the end of the day. The technical term is open comedones and closed comedones. What the heck are they? Open comedones are blackheads, right? So it's a little black dot on your skin, and it's a mixture of sebum, dirt, excess cells, all trapped in a little follicle just here. So, well, coming through, where are we actually? You might be able to see, I don't know if you can see from here. We might be a little bit too far away, but anyhow, comes out of the skin where the sebum and everything comes. So it's the follicle, it's the hair follicle there. And basically, the reason why it is black is because this sebum and dirt and all of that is exposed to oxygen. And I'm sure you all know what oxidization is, because when you bite into an apple and then it's beautiful, it's crisp, it's white, and it's lovely, and then all of a sudden it's going brown. Why is this happening? And you just kind of put off of your apple. You're like, oh, don't really want to eat that. It's oxidized, right? So it's oxygen being introduced to this beautiful apple with lots of antioxidants inside of it. So that's basically what happens to, almost fell over then. That would be embarrassing. And it basically goes dark because it is exposed to oxygen. So basically, these little blackheads, you do want to have them removed, and you can have them professionally removed and extracted in clinic. I do that for a lot of my clients who it's safe to do so for and who need it, and especially with acne. We safely extract them without causing any tearing of the skin, inflammation, and all of that. Because the thing is, this blackhead, so this little pore, it basically, if you let that fester and continue to get bigger and bigger, sometimes that will happen. The skin will automatically want to push it up and out. It will want to push it up and out. But sometimes, instead of it going up and then falling off, what you find is the follicle, instead of it going kind of coming up, the follicle widens. So it widens, and what you see is the oil coming through and it basically opening that follicle. And the thing is, you don't want to experience that, because what happens is that follicle can actually get to a stage where it's so stretched that it can't recoil, right? So it is stretched so much that it is now permanently stretched open. Now, this usually happens in those who are a little bit older, but I have seen it in ladies in their 20s and 30s, and what we actually call these are whiner pores. I know my mum is watching right now just going, yes, I have one. And it's not the greatest thing to have, but it's not the biggest detriment to your skin. Essentially, you'll know if you have one because it's essentially a little spot on your skin that continues to fill up. How annoying. And you just have to literally for the rest of your life pop it, and well, not pop it, but extract it very gently and let that oxidized sebum and excess skin cells out, because it will stretch it even more. And you'll actually see, probably from standing here to here, you'll probably see it on the skin. So comment below if you know what I'm talking about, if you have any questions relating to this. I'm really, really happy to engage with you while I'm here live. So that's what an open comedone is, and that's what an open comedone can lead to. It can become a whiner pore, so a stretched pore. What is a closed comedone? Well, very, very similar, and it's basically a blackhead, but with a thin sheet of skin over the top. So it basically is getting caught underneath, and it's not being able to release. Now, a closed comedone doesn't generally have inflammation, the same as an open comedone, so that's a good thing. We don't have a bacteria buildup generally. It's just hard and dry, sebum and dirt and whatnot, and it's trapped under the skin. And it is very, very tempting to get your fingers in there and basically, you know, pop it, and you'll find all these little stringies come out. I know you've done it before. They kind of look skin colored, and they're just like little bumps under the skin. And it's best not to, because most people will cause trauma and inflammation, and therefore you're going to have scarring on the skin. You don't want that, but that's okay. We've all been there. But essentially, we need to actually address why they're happening in the first place. Again, let's go back to the barrier. Is that impaired? Are we retaining water? You know, are we getting enough essential fatty acids? Are we giving the skin the right ingredients? It's all of these things that I do here in clinic that we can use to treat this condition. Is there excess keratinization? There's so many components. So that's essentially what a closed comedone or a whitehead, whatever you want to call it, actually is. Now, Gracie Briffer has just asked, can you get rid of wino pores? Wino pores, whatever. I think it's whiner. I think that's how you say it. But anyhow, you can't really get rid of them. I'm sure there is some sort of advanced dermatology procedure where if the whiner pore is that large, they can stitch it kind of back together. But generally when they're so small, when they're just a little spot in the skin, just a pore that essentially has become widened and can't recoil, yeah, I don't think there is any procedure, not ones that I have been taught. Please, if you find out, let me know. I find that really interesting. I don't see the need though, because it is such a small pore. It would be annoying for sure to have one, but an extraction process every 4 weeks is honestly enough. And you can just get a little extraction tool and extract it yourself, or you can put tissues around your fingers and carefully extract it yourself. So that is my answer to your question. But essentially that's open and closed comedones. The next on the list was keratosis pilaris, and this is an interesting one, and I think a lot of you know what it is, but you have never put a name to it. Hands up or comment below if you have little red bumps on the backs of your arms. You know those little bumps, kind of a bit of redness around there. Sometimes they might not be so red, but they'll look a little bit skin colored. They're a little bit, it's like a little bit bumpy. Some people get them on their thighs. Some people get them on their buttocks. Some people get it on their cheeks and sometimes the forehead as well. Please comment below, or maybe do like a whole heap of love hearts. Just do a whole heap of love hearts and let me know, do you have this condition or have you seen it before? Because generally what I've just described to you is what keratosis pilaris is. Now, it's really interesting. A lot of people have it, and when you Google keratosis pilaris on the internet, yeah, there's a lot of misinformation, but essentially it is, unfortunately, you are genetically predisposed to it if you have it. Now, it is associated with what we call a filaggrin gene deficiency, and basically most people who are Caucasian, have an Irish and English background, have a filaggrin gene deficiency. If you've ever had eczema or dermatitis, you probably have a filaggrin gene deficiency. Yes, yeah, you see it a lot in your clinic as well, Jen. I bet it's an annoying skin condition and it kind of tends to come back, doesn't it? I've definitely been able to keep it under wraps and keep it gone for a while. It really just depends on the client and their lifestyle and all of these things. Hey, it's an annoying one though. But anyhow, where was I at? So the filaggrin gene deficiency, and most people, a lot of people have it, and I have it, and basically it just means you have a predisposition to your cells compacting in a really annoying way, in a way that is irregular. Remember that brick and mortar, it just means the cells are not compacting correctly and they're a bit irregular. And what you find with this keratosis pilaris in the back of the arm or in the face or wherever you unfortunately get it, it's kind of like plugged up. So you have an excess of skin kind of coming up, and it kind of plugs up the pores and it creates inflammation in the area, and that's why you get the redness as well. Now, I treat this condition with 2 or 3, I have a couple of different products, so many different ingredients I could be using, but essentially, I'll just see if I can find it. This is probably my holy grail product for treating keratosis pilaris. This is the Sussmone Lution P by Dermavisuals. I only stock Dermavisuals here at Soul Awaken, but essentially, this is fantastic because it has cherolytic agents in there. What is that? You can kind of see how the words are sounding similar, right? So keratosis pilaris, cherolytic agents, and basically what that does, it smooths out the skin. It helps to calm down this excess of keratin on the skin, right? So that's in the form of urea and what else? Yeah, it's the urea in here. So this is fantastic. You actually spray it onto the area. So you spray it onto a cotton pad and then wipe over. And it's fantastic. I use this with acne a lot and so many skin conditions. It's fantastic. Can be a little bit drying. And I'll often team that up with another moisturizer, maybe a moisturizer with a bit of salicylic acid in there, perhaps even just a really plain moisturizer with a bit of vitamin E. So there's a lot of different things you can do. It really depends on the person and the area and what the skin is needing. But essentially it's not hard to get this condition sorted, but don't listen to the internet. The internet, when you look up this condition, they say just exfoliate. And the thing is, yeah, you can exfoliate, and that's kind of what that product does, the Lotion P, kind of. But if you just sit there and exfoliate this area every single day, you're going to irritate the skin. You're going to cause more inflammation. It's like putting fuel to the fire. So there's a lot more to it. And it's about, again, that inside out therapy. So we want to treat the root cause, not just, put a band-aid on there and just, scrub until we can feel like we're starting over again. It'll give you an instant relief, of course, but it's not going to fix the issue in most cases. So that is keratosis pilaris. Again, I see it on the cheeks quite often. I tend to see it more on females on the cheeks. I think there is a statistic to say that it is more prevalent in females. Not sure why, but there you go. So let me know if you have any questions about it. Happy to talk to you about it. I have an email that I send to all of the clients who I end up seeing this condition on their skin. So definitely let me know if you want me to send that email to you. If you are listening and you're like, want to know more, I'll happily send it to you. There's a few little dermatology links in there as well. And the last on the list is the loss of collagen and elastin in the skin. Now, fancy words to basically just say aging. But the thing is, aging isn't always about the texture of your skin. Oh, glycation as well. I wanted to cover that too. But they're all under the umbrella of aging. And again, aging it doesn't have to be the texture of your skin. Aging can look like dark spots on the skin. There's little solar latingies, like age spots that you see up here. Aging can be so many different things, like a lot of redness and inflammation in the skin, but this is just a form of aging. So a loss of collagen and elastin, and collagen and elastin is found in the dermal layer of the skin. So this big thick layer here. And essentially, unfortunately, as we kind of get past that age, about 21, 25, things are going downhill and we're just not producing enough of the cells that essentially keep our skin plump and lovely and looking really young. And Mum says, Gracie Briffer, who is also my mum, just said wrinkles too. Well, that's basically what collagen and elastin loss will eventuate to. So it's just the technical term for wrinkles. So I'll get into it a little bit more for you. But essentially, there's a lot of fibers that keep this nice and plump. There's a lot more to it, but kind of keep it plump and firm and thick, you know? So there's all these networks that are holding the skin up. And unfortunately, when these networks are being pulled away because we're aging, right? You know, smoking is really bad, sun exposure is really bad, sugar, stress, inflammation, all of these factors lead to aging and the degradation of your collagen and elastin fibers that are holding your skin up. And what happens when these collagen and elastin fibers begin to degrade? What you see is the skin starts to go down. So you can kind of imagine this is a nice plump skin with good strong elastin fibers keeping it sturdy. What you start to see, and you can imagine my fingertips as where a wrinkle would be forming, the fibers are becoming broken, so you go and you start to see a little bump in the skin essentially. So then you have a wrinkle form. Now wrinkles are of course formed through facial expressions, but they're also kind of exaggerated by the loss of collagen and elastin. So collagen is basically what keeps your skin plump. Elastin is the elasticity of your skin. So basically that coil, the recoil of elastin will get more lack as we age, unfortunately. And we are all predisposed to a certain type of aging. So I'm going to touch on glycation as well, but we're all, depending on our genetics, we're predisposed to a different type of aging. So some people are predisposed to a loss of collagen, which generally looks like wrinkles on the skin. Some people might be droopers, and that's usually a loss of elastin. So, you know, melting. The face is falling, right? It's kind of falling off. And collagen is more, loss of collagen kind of looks like little wrinkles in the skin. You kind of see them like this rather than that. Another type of aging is glycation. And glycation, if you're prone to glycation, I'm really sorry to tell you, but you're gonna have to lay off the sugar. Essentially, glycation looks like cross-hatching on the skin. So it kind of looks like, you know, your quilt, if you have a quilt and the kind of stitching, you have all those little squares, right? And the stitching around it, that's what glycation looks like, little pillows in the skin. It's very, very small, but it kind of looks a little bit like a quilt. Really kind of zoom into that. But essentially glycation, you really want to make sure that you're not having an excess of sugar or alcohol and a bad diet. It will exacerbate this condition. Now this is something, you know, glycation is usually only seen on older skins, more mature skins. So, you know, if you're in your 30s or your 40s, you're probably not dealing with this right now. This is a bit more later on, but if you've been damaging your skin and really doing the wrong things like suntan beds and smoking and drinking a lot of alcohol, eating a ton of sugar, you might start to see this prematurely forming. And it's basically your molecules just being damaged. I'm not going to go into exactly how it all happens. It's a bit of a acidity with glucose and a whole heap of things. So let's not get into it. Let's just talk about what it looks like and the way to prevent it. That's the most important part of this. So you want to make sure, again, have a really good diet and you can prevent these things from being as exaggerated as they are. While we're on the topic of aging, I might as well talk to you about the other two signs of aging, which is vascular kind of issues, so redness and heat in the skin, inflammation, and as well, what was the other one? I just mental blanking, pigmentation, so dark spots on the skin. Dark spots on the skin is a really, you know, we're all going to get them because we're all exposed to UVR, so the UV radiation from the sun, but we can limit the amount, and you've probably guessed it already, wear your sunscreen. I am very cautious for myself. I see it a lot, age spots all over the hands and arms, all over the chest, over the face, and I know a lot of you are very cautious about wearing a daily SPF. If you're going to be outside or if you're sitting in front of a computer or near a window, you know, you want to wear SPF, right? But are you just putting it on your face, or are you actually going all the way down your neck to your décolleté and the backs of your hands and your arms? Are you doing that? Are you going that far? That's okay if you're not, I understand. But I am very adamant on this because especially when I'm driving, I think about all the women I've seen over the time they've been doing this, and I see those little spots on the backs of their hands, and honestly, just by putting on an SPF before you go out can really limit the amount of these and that damage where you see the skin, again, collagen and elastin loss and kind of wrinkling up. Just wear sunscreen. It's really, really simple. It's really easy. And yeah, you just take it with you, put it in your handbag. If I'm going for a drive that's longer than 10 minutes, I'll generally put it on, because think about it, you've got your hands on the steering wheel, UVR can come in through the glass. So that is my method to dealing with age spots, so a type of aging, pigmentation. And what was the other one? Vascular. It's basically, there's lots of different vascular kind of conditions, and we'll talk about that next week, but essentially just reduce inflammation in your skin. So you can do this through making sure your skin is healthy, repairing the barrier of your skin, and most importantly, making sure that your internal health it's on check, right? That's not how you say that. I'm really bad at sayings, but you know what I mean. Make sure that your internal health is doing well. I just can't put the words to that, but you get my point. So just look after your health, make sure you have low inflammation levels, and essentially you won't have as much redness and heat and things like that in the skin. Some people are predisposed to inflammation and inflammatory skin conditions like rosacea. But essentially, you know, get to it. If you have inflammation in your skin now and you're in your 20s or your 30s or even your 40s, do something about it now, because the longer you maintain inflammation in your skin, the quicker your skin is aging. Remember this always, inflammation equals aging, inflammaging. Whatever, but it's true. Deal with the inflammation ASAP, because you don't want it to be becoming a thing that's ongoing and it's damaging your skin, and then you've got all these little capillaries going on. We definitely digressed on this talk, but I thought it was really important to just fill that little 5 minutes of time we had talking about the different types of aging, as we spoke about the loss of collagen and elastin, which essentially is wrinkles on the skin. I hope you found this really interesting. It's there's a lot more to it and there's a lot more science behind it, but that is essentially the main conditions relating to texture in your skin and the conditions that I treat. Remember, I'm not a dermatologist, I'm a corneotherapist, and I work on aesthetic skin conditions within my scope of practice. So if you have some sort of condition on your skin where you're worried about a little dark spot kind of crusting over, or an irregular mole, or who knows, if you don't know what it is, there's a bit of inflammation, you've got a random rash going on, don't come to me straight away. Go see your doctor and then go get a referral for a dermatologist. A dermatologist specializes in skin diseases of the skin. And remember, they're a trained doctor with extra experience because they had to do dermatology. I think it's a couple of years. It's about 11 years in total. It's a lot of years of study. So I treat the aesthetic conditions and a dermatologist can treat the diseases. So please don't hesitate if you do have a skin condition that's come up, even if you might just think it's an age spot or a mole or whatever, definitely go get checked. And while we're on that, please make sure you're getting your skin cancer checks every 1 to 2 years. You need to do it. You absolutely need to. If you see your mole change in size and diameter and feel and texture, go to your dermatologist, book an appointment, get a check. It's really simple actually. They basically look at your whole body and they record down all the spots. They send you off for a biopsy if it's something's irregular. They test it, they bring it back to you and they go, yep, you're fine, all good, we'll see you in 2 years. It's really simple. Yep, that's it. I've been talking for the last 30 minutes flat out. I hope that you learned something today about the skin, about the texture of your skin. If this has left you with more questions than answers, I'm sorry. I will happily answer them if you have them. So please comment below and I can do a separate video talking about all of this. And as well, if you wanted to hear a video on essential fatty acid deficiency and why omegas are so important for your skin, please also comment below and let me know. I'd be happy to do that. I'll see you all next week, where we'll be talking about skin conditions related to color. So that can be pigmentation and vascular conditions. So I'm looking forward to that. Have a really, really lovely night, souls. And again, just remember, you can always book in with me and have a skin consultation. And I'll go through all of this for you, and you get that skin report emailed straight to you with all the extra information, so you can understand your skin and transform your skin and have it nice and healthy. All right, have a wonderful night, souls. I'll speak to you all soon. Bye.